Welcome to today's event on the private uses of public health identity at the Ada Lovelace Institute. My name is Imogen Parker. I am the head of policy at Ada. And for those of you that don't know us, we are a research institute based in the UK with the remit to ensure that data and AI work for people and society. This is the third now in our series exploring the emerging development of what we're terming public health identity systems. So some form of verification system or app which combines private health information with a public health identity. And much of the discussion to date, I think, has naturally drawn to government consideration of tools like immunity passports or health status apps. But today's event, we want to take a different angle and we want to focus on use by non-state actors. We've seen a number of we've seen early exploration, I would say, by a number of private companies around the world, numerous digital identity companies developing apps to incorporate immunity or antibody tests, and some instances of companies trialing their use. So one of the applications I think we know perhaps the most about is in Estonia. NTU Back to Work has been developing an immunity passport system with a QR code linked to state-issued ID, which is currently being piloted by a number of local firms. There's been much discussion, but not much detail on a couple of initiatives a bit closer to home. So the UK company Visagi has created a Corona Pass app, which they announced they're trialing with Ernst & Young for their employers and their clients. In Spain, I think back in April, the company Voten rolled out a digital health passport, said they were trialing that with PwC, but I don't think there's been many updates since then. And another area that I think, as well as employment, which seems like an obvious use case, we're seeing a lot of interest from travel and hotels. Pangea, an Israeli digital ID and border control software firm, has proposed a biometric smart card to store antigen and antibody test results to allow passengers to use flights at airports. There's a few other kind of products in discussion, and while those are just in proposal phase at the moment, there is definitely, I think, growing and quite vocal interest from the travel sector about this. The chief executive of Heathrow has backed it. The International Air Transport Association, which is a trade body that I think covers about 80% of all global air travel, has said they would back immunity passports to segregate no-risk travellers if and when it's backed by science and by governments. So I think while the practice certainly isn't widespread, we are certainly seeing emerging private initiatives evolve. I think just on Friday, there was a Business Insider article where the chief exec of the ID verification startup Yoti reported they've been holding a number of talks across industries from sports, entertainment, travel, logistics, manufacturing and healthcare, and another company on Fido have reported dozens of companies register interest and a number of trials and initiatives underway, details not forthcoming. So this feels to us certainly like an important moment to have this conversation and to focus on the private sector uses. And in the UK context, on Saturday, the government advice to England is going to shift. It's going to give employers more discretion about requiring people to return to their workplace if they can make workplaces safe. So I think that provides a very front of mind use case, as well as raising questions, that we've seen certainly trade unions voice in recent weeks about how COVID is opening the door or kind of accelerating some risks about the technological surveillance of workers. And that's certainly something that we should consider alongside this. So that brings us to today's event, and I am really delighted to be joined by three extremely knowledgeable speakers to help us navigate the questions of private sector use of identity passports and public health status apps. We have Dee Masters, who's a barrister at Cloisters and also with legal consultancy AI Law Hub. She's a specialist in employment and discrimination and is currently has worked on similar or related issues with CDEI, TUC, the Council of Europe, as well as employers, employees, unions, and NGOs and government. We've got Katie Jacobs, who is Senior Stakeholder Lead at CIPD, the Chartered Institute for Professional Development, where she's responsible for building a community of HR leaders to consider employee needs at the moment. And we've got Sid Venkataraman, European technology correspondent with the Financial Times. And I want to start by turning to you, Sid, really to set the scene on, I know you've been following these issues very closely for the FT, and it'd be great if you could just open up this session on what you've seen in recent weeks on the private uses of these systems in UK abroad, what kind of trends are emerging, what we know about the proposals put forward.
Brilliant. Well, brilliant. Okay, hopefully that's working now. Thank you so much. Really excited to be here today. And I think probably it's worth taking back further. I think May was really when we had the first sort of surge of interest in these topics. We had news that Onfido, Yoti, and other companies from the UK and Europe were trialing presented their systems to the government for potential use in an immunity passport system. And then we sort of had a lull sort of for the last few months, and now we're starting to see interest pick up again. I think it's worth noting that there's also a lot of PR and puffery around this space, so it's sometimes hard to work out what is actually happening and what is simply a company retooling their existing tools to argue that they could be useful when dealing with COVID. I think in terms of a general immunity passport outlook, they've largely taken a similar status or similar form because most of the major companies are from a digital ID background. So you'd have a digital ID system created using biometric information combined with, say, a passport photo. You'd use that when you go to have a test done, and when you went to an employer or a private venue, you would present that information in the form of a QR code in most cases, although in one case, a sort of another proprietary code that will be presented, and they would be able to see that you either had immunity implied through antibodies or that you were clean of COVID-19 at a certain point. But that being said, there are specific ways in which different companies have tried to differentiate themselves. Of course, there are different ways in terms of cybersecurity, which each company has naturally said that their system is the most secure and the most efficient way of minimizing data. There's a lot of discussion currently going on around immunity versus health passes, and I think immunity passports were certainly the term used in the past, but there have been a few examples who have attempted to avoid the term because they understand that immunity is fundamentally not really something which we can rely on when it comes to COVID-19, and that there's still so much debate around that, and the WHO statement against immunity passports was fairly stinging. I'm frankly surprised that we're still having a discussion around it, considering how negative they were on the prospect of that. There's also the question around linking this to larger health data, and several of the companies have talked in sort of general terms about either connecting it to biomarkers and sort of the work being done around wearables and COVID-19 to sort of spot what's happening in our bodies around COVID-19 before it really breaks out into full-blown symptoms, or say looking at other test results and creating the sort of all-in-one digital health system. But these have largely been pitched, from what I understand at the moment, as sort of longer-term plans rather than for immediate rollout. And also just one interesting idea is the idea of at-home testing versus professionals, or the use, and there's only one company or one organization which has really discussed this, which is CovClear, which is a citizen science group, which has been looking at how you could, in theory, deploy these tests at home if you really want to get to the mass testing scale that you would need, I think, for this sort of idea to be effective. In the private space, it's interesting, I think, that there's a lot of tech solutionism going on, which has actually made it quite hard for immunity passports or health passes to really get a foothold. You have people deploying systems with facial recognition and thermal scanning. You have lots of sort of social distancing, scanning, AI-based systems as well, and even wearables being deployed by various companies, with the implication that you'd be able to tell what was happening to people sort of in real time. But there are certain sectors where we have had some uptake. I think sport is certainly one where we've seen the most interest early on. We had VST, who produces the V code, which is used by CoviPass, one of the digital identity companies, suggesting that their system could be used for reopening the Premier League. Another one is hospitality. Onfido, the British company, and SideHide are working on, or were testing an app, essentially, which would allow access to specific parts of hotels where social distancing was not possible, for example, in saunas. And the Estonian Back to Work initiative has also been working with various hotels in the country. And finally, around air transport, as Imogen mentioned, Heathrow, we've seen quite a bit of bullishness there from the CEO. And Back to Work, I understand, has now moved on from doing the in-country testing to looking at how cross-border travel would work. So finally, sort of wrapping up my time, I just talk about the kind of wider trends this fits into. I think there are a few interesting points. Firstly, there's a really interesting culture clash going on, I think, at the moment, because we have, on the one hand, a greater acceptance of these kind of broad surveillance techniques around COVID, even as there's a general move against the use of this technology and the mission creep in areas such as police surveillance. I know things like facial recognition or criminal recognition algorithms being produced have kind of sustained attack by academics and by activists. And it's interesting how we don't seem to have the same reckoning as yet with these systems being deployed ostensibly for health purposes, which are likely to have long-standing impacts on society. Secondly, I think specifically around the use of immunity passports and health passes, the question of mass testing, and at what level testing is set at essentially, and how far the actual practicalities of how many tests are available in any given country affect how often we test, and how often we test actually affects how effective these systems are. And I think there's really a lot of talk of the government will set the line or will allow our clients to set the line, which doesn't really, to me, suggest that there's any immediate proof that the companies know what's best to do. And finally, I think just the question about how we walk back these systems in the future, and whether there's a way that we disembed systems which are found perhaps not to be as effective, or which are found to have embedded unhealthy or in fact exploitative practices into society.
Fantastic. Thank you so much for a kind of great whistle-stop tour of some of the uses that we're seeing emerging. Katie, I wonder if I could turn to you now, perhaps to pick up the kind of business and employer perspective on this. I mean, do you see an emerging clear use case for employers exploring these? Have you seen much interest from the organisations that you're in touch with around things like immunity passports or health status apps? Do employers see this as an important step in ensuring that their workplaces are safe and they can get people back to work?
So I think it's really interesting. It's a very emergent area, which means I probably got a lot more questions than I have answers. So just to give a bit of context about the CIPD, our members are HR and people development professionals. So we've got about 150,000 members, mainly based in the UK, but we've also got offices in the Middle East and Asia and Ireland as well. And my role is that I work with the most senior end of market, so kind of CHRO and CPO levels. So when I was thinking about this, thinking about a lot of the conversations that I've been having recently, because I've been holding, I guess you would call them weekly, almost therapy calls with HR directors in quite large businesses. So that's been a really interesting experience, because we've been doing those since March. And so kind of got a picture of how priorities have changed and the kind of things that people are interested in. So stuff that has come up. Organisations, like Sid said, there are sectors where this is going to be more important, and it'll be organisations where the priority has to be keeping a clean site, where anything that compromises that would have a really, really profound impact on productivity and income. So that would be sites such as food production, manufacturing, Sid mentioned hospitality, anything where you might just need to close down and then kind of lose all of your income stream for the foreseeable few weeks. One thing that has come up is antibody testing, and whether people can start testing their workforces. I'm just going to read out a direct quote from somebody, which is on a forum that I run for CHROs, saying they've been asked if it's feasible by a senior leader, they want to use it to decide a priority order for who should come back to the workplace or out of furlough. I'm certain that this isn't legal. If anyone can point me in the right direction, that's where we're able to show them why we can't do this. I'd be very grateful. So you can see there's quite a lot of confusion over that. And in the discussion, we did decide that it probably was discriminatory. I'm sure Dee will pick up on these kind of issues. Another use case that I thought might be potentially useful would be organisations that want to get people back to the workplace but are dealing with quite profound anxiety issues. And we know from our research that this is a really big issue. So according to our research, about half, 49% of people that are not currently attending their workplace are anxious about returning. 21% of people who have been attending their workplace during the pandemic say they aren't satisfied with the health and safety measures put in place, and 12% of workers don't trust their employer to provide a safe environment when they do return to the workplace. So there is a sense of potentially these systems could give some kind of peace of mind. Some of the HR directors that I speak with have been using temperature checks at entrances, and they acknowledge that there isn't a huge amount of evidence for these actually working, but they find that they make people feel more comfortable and confident. So they've kind of got themselves into a space where I think one of them said in a call a few weeks ago, well, now we put them in, we can't really take them out again. So they make people feel a lot more comfortable. However, this also could backfire if people get too comfortable and start behaving kind of recklessly and carelessly. And then I just want to run through some of the considerations and the questions that come up when organisations, and particularly people leaders, are deciding whether to implement or use these kind of tools. So the first pretty obvious one would be data governance and privacy concerns, so related to GDPR. So the HR directors I'm speaking to see this as a really big concern, where you store the data, how you use the data, how you anonymise the data, how you keep it safe. The second massive issue is ethics, and just because you can do something doesn't necessarily mean you should do something. So what would the impact be on things like employee trust, engagement, morale? What impact could it have on the psychological contract? And it could be a positive. People could feel like you're trying to protect them, or they could feel edgy about a loss of privacy, especially because I think health data is the most personal form of data. So are there risks that it could expose other health conditions that people didn't actually want their employers to know about? And I think it links into something I think Sid mentioned, a worry about mission creep. So you start here, but where does it end in terms of the surveillance and monitoring of your staff? I think you could potentially end up in a kind of almost a new class system of employment, where you end up discriminating against people who've never had the virus. And that opens up quite wide questions such as should you be actually making a value judgment at all based on people's health and choices? So it's a little bit like with wearable health technology. So is it right that your employer sets expectations around what appropriate behaviour is in terms of getting your 10,000 steps a day or going to the gym? Does going to the gym make you a more committed and worthy person, more worthy of promotion than somebody more sedentary? So you kind of get into some quite murky areas. And then there are lots of kind of quite granular practicalities that businesses have to consider as well. So if you're a multinational, is it possible to be consistent across countries? Lots of the global businesses I work with were struggling with issues like whether to get everybody masks, because it's not mandatory everywhere. So this kind of takes it to the next level, makes it very, very complex. And then if you're expecting people to use things like apps on their personal phone, is that a step too far? You've got the kind of blurring of the personal versus the professional. What if people don't carry their phone everywhere they go? If you're in a manufacturing site, you might not be allowed to. You might have to keep it in a locker. If you're a woman, you might not have pockets. So how do you kind of get over those kind of user-centered design issues? And then there's the fact that surveillance often has the opposite effect to what managers might hope. So when lots of the tools that we use to survey people are intended to increase productivity, but they can actually do the exact opposite. So there's a ripple effect that's created to beat the system, and it can become a bit of a downward spiral. And I think that most clearly applies to monitoring tools, which can backfire as people try and game the system. So for example, when you don't get your parcel delivered because they're trying to shave a few seconds off their time. But I could see how it could apply to these, because is there an incentive to beat the system by catching COVID or becoming immune and therefore being preferred for work? And then I just wanted to finish on some general thoughts about employee surveillance. So it's a really emergent area. It tends to be linked to productivity, and I think it's raised its head a lot more in recent weeks, given many of us are working from home, and for leaders are not comfortable on managing on outputs and instead are really obsessed with inputs. They want to know people actually working by tracking productivity. And I just think it's a really dangerous game. It comes with lots of risks and many unintended consequences. I'm sure that lots of people watching this will remember there was that Barclays case, that was back in February, I think, before we thought that we would all be working from home forever. But that bank came under huge criticism for installing what was kind of referred to as spyware. So new technologies, they can promise this greater management and insights, but they can have a serious impact on trust, employee relations, and employee morale. And you also obviously need to consider the data issues and the legal considerations around GDPR. And I just want to share some new data from us. We did a bit of research recently on employees and usage of technology. So we found that 45% of employees believe that monitoring is currently taking place in the workplace. 86% believe that workforce monitoring and surveillance will increase in the future. And 73% feel that introducing workplace monitoring would damage trust between workers and employers. So our general advice when employing emergent technologies would be to consider the people impact front and centre, and to involve HR in the process early on, because we feel that people professionals need to ask objective and challenging ethical questions about the application of any new technologies, and to think really critically about any unintended consequences which might occur. So those are my opening thoughts. Quite a lot there.
That's brilliant, Katie, and yeah, absolutely endorse the thinking hard about the ethics. I just wanted to ask a quick follow-up question, and I suppose a link into Dee's opening comments, which is how whether you feel there is enough guidance for you? You know, you're clearly grappling with a whole host of questions, different types of regulation, emerging tech approaches. Whether or not you feel that there is clear guidance and regulation around these private uses, or whether that's something that you are with your network having to almost kind of feel your way towards a good approach.
I think probably there's room for more, but I think the issue is, obviously you can have the legal guidance, but it's also about the practical application. So that's some work that we're actually going to be kicking off quite soon, looking at the kind of responsible technology adoption, because you can have all the kind of regulation in the world, but ultimately there's the kind of practical side of it as well, which can often get missed.
Brilliant. Thank you so much. Now, Dee, could we turn to you to think a bit more about this, I guess, what you see the impacts of digitally verified antibody certificates to be on the questions arising around employment law, principles of non-discrimination, kind of where the legal situation is in this, and in particular whether there's differences between approaches to people that are already employed versus perhaps those applying for new jobs. So over to you.
Thanks, Imogen. Yes, so, and I want to pick up on some of those points that Katie made about guidance as well. So I think that the first point to make is that there are numerous very real discrimination angles when employers, or indeed any organisation, is using a digital immunity certificate system in the wrong way. The first angle, the most obvious angle, is disability. We know that many disabled people were shielding during lockdown. We know that many disabled people, even now, will be minimising their contact with populated areas, whether it be the supermarket or the workplace. Accordingly, it's very likely that we will have a disabled population which would find it very difficult as a whole to demonstrate that they have COVID-19 antibodies. And I would imagine that we would see similar patterns when it came to other protected characteristics. So it might well be the case, for example, that older people as a whole, because they've been more careful and because they've been shielding, may have lower likelihood of COVID-19 antibodies. Equally, it may be, because we know there's a racial impact, that certain racial groups might again have a different profile when it comes to testing. Now, if that's right, if there is a connection between protected characteristics and the ability for someone to demonstrate that they have, for example, COVID-19 antibodies in their system, there's a real risk that if people are denied the ability to come back to work, or perhaps denied access to certain areas of an airport or a hotel, to use some of Sid's examples, there's a real risk that what we might be seeing is a form of discrimination which would be unlawful under the Equality Act. Now, I stress the word might, because in reality, so much of this will be fact specific, and that's the practical perspective that Katie was talking about. It will ultimately come down to what is the employer or organisation trying to achieve. Are their actions proportionate? Do their actions actually achieve the aims and objectives that they're setting out to achieve in the first place? And I wanted to just spend a few moments just illustrating some of the nuance around this by perhaps positing two quite extreme scenarios, but I think illustrate the grey area here. So let's imagine, for example, scenario one. Let's imagine an employer who runs a huge department store. They've been really hit during the lockdown. They need to cut costs. They decide to have a redundancy exercise, and they decide that they will prioritise for redundancy those individuals who don't have COVID-19 antibodies. So a slightly more extreme example of that scenario that Katie was talking about earlier. Now, let's imagine this employer, in entirely good faith, thinks this is a really sensible way to do their redundancy exercise, because they think, first of all, it will make shoppers feel more confident coming back to the store, but also they predict that they will have lower sickness rates going forward. Let's imagine that this redundancy exercise goes through and the employer ends up with a working population that's predominantly younger, predominantly non-disabled, perhaps even dominated by certain racial groups. Now, if that were to happen, I think there'd be real difficulties from an Equality Act perspective. There'd be real difficulties because when it came to showing that the employer had acted proportionately, they would struggle to show that the science really backs up what they're trying to do. So we know, and Sid alluded to this earlier, that there's a question mark about whether COVID-19 antibodies actually mean immunity. And certainly to my knowledge, there's no evidence to suggest that just because you have the COVID-19 antibodies, you're not then passing it on to other people. There'd also be questions about privacy, there'd be questions about reasonableness, all of which would be highly relevant to different types of legal claims. So for example, unfair dismissal claims. But there is another perspective to this. There will be situations in which, in fact, it might be advisable, it might be sensible to look at someone's COVID-19 status. So imagine a second scenario at the other end of the spectrum where you have a patient who has to have a life-saving operation on a particular date in the future. You have a pool of surgeons who are all equally qualified, equally skilled. In those circumstances, it might make perfect sense for an employer to say, well, the surgeon I'm going to choose for this operation is the one that has the highest COVID-19 antibodies in their system, because whilst that doesn't necessarily mean they're immune, I've got the highest chance of that surgeon being well enough on the day that the surgery needs to happen. So this is nuanced. We can't say something like digital immunity certificates will always be wrong, nor can we say they will always be right. Equally, we know there are nuanced AI health monitoring systems, Sid alluded to some of them earlier, that might be very helpful to employers when it comes to fulfilling other obligations they have, whether it be an obligation to make reasonable adjustments for disabled employees or making sure that the workplace is safe for their colleagues. So again, it could be that this tech properly used can be very, very powerful. So I think we have a legal system that could adequately police this. We have the Equality Act, we have unfair dismissal legislation, we have a right to privacy. But the big problem for me, and I think it really is a very significant one, is that this legislation only protects people insofar as you have a workforce, for example, that's willing and able to litigate. And it seems to me that where you have something as controversial and as important as, for example, immunity passports, we can't expect or ask individual employees, individual workforces to be the guardians of safe tech. And something that my colleague Robin Allen QC and I have been thinking very hard about, and this part of the work that we've been doing with the CDI, for example, and talking to the TEC, is how can we manage this? How can we harness the benefits of tech? How can we make it trustworthy, but also by sidestepping some of the potential unlawfulness and some of the perhaps discrimination that might occur? And for us, the answer to that is some sort of very sophisticated and robust certification scheme. So imagine a world in which if you are an employer and you want to use these forms of tech, it can be audited, it can be certified by an independent third party, and you can be told before you deploy it, yes, this is an acceptable system. Yes, you have a set of facts here, which means it's acceptable and okay for you to do what you want to do with it. That to us seems to be the answer, and it's not a new idea in the UK. So here we have something called the Surveillance Camera Commissioner. They can certify as an independent third party certain types of tech to make sure that they're secure and they're safe and they're being used appropriately. And it seems to me that this is really the point at which we have to pause and we have to take stock and we have to say, how do we think organisations should use this tech? And we need to spell it out now in the kind of practical detail that Katie's talking about. We don't just want convoluted laws, we want practical guidance so employers and organisations know precisely what they can do and what they can't do.
That's fantastic. Thank you so much for that opening. I was wondering, just as a follow-up to that, while that sounds like an eminently sensible idea as part of the landscape, if now we have companies exploring this and potentially piloting this at the same time as we have the WHO's, not updating their guidance around the validity of any sort of immunity passport scheme and raising some challenges around that. Is there anything firmer, I suppose, that needs to be out there in terms of law or policy or government guidance about advising employers about using this, about private sector uses? Or do you feel that the current regulations, the current guidance that's there is at least adequate in the short term?
I absolutely think we need more guidance.
Yeah.
Absolutely. I mean, this is a new area. People have got all sorts of ideas about how it might be used. As Sid says, there are all these companies, pushing this technology, saying there are these sort of wonderful benefits. And it's easy to get lulled into a false sense of security that all uses will be acceptable or lawful. And a lot of this tech is being pushed from different jurisdictions. So from the US, for example, where they take a very different approach. And what we need now is some sort of cross-regulatory approach, so that you have all these organisations who are part of this space, whether it be employer organisations or employee organisations or data protection organisations, sort of pulling together and producing something really practical to explain what you can do, and then ideally backed up by some sort of auditing and certification scheme, so you can know beforehand that it's acceptable, rather than falling back on litigation after the event to identify when something's stepped a line and isn't acceptable.
And a follow-up question, I think, for all of you as you're working, or you've been examining this internationally, are there some countries that are leading the way, if not in the use, but I suppose in the processes, in weighing up the social and ethical impacts, in offering guidance, in ensuring that any tech use is seen as publicly legitimate? Do you think there's any examples that the UK in particular should learn from, or is this something that all countries are grappling with, I suppose, equally?
So I think all countries are grappling with this equally. What you do have is a very much a sort of a view within Europe more broadly at a European Commission level to look at regulating this, and they're producing various white papers and consultations, and they're proposing legal instruments which will identify high risk uses of tech and AI and put in place common rules across Europe so that we all know where we stand. But of course, it takes time to put that sort of legislation together. And so we're not expecting to have any sort of concrete regulation until next year. And that's why, whilst the UK is obviously Brexiting, it is likely to be influenced by European standards. But more importantly, it needs to be thinking now in advance of any new European standards that international companies will have to comply with, what's acceptable and what isn't acceptable, so that employers know, bearing in mind the change in guidance this weekend, what's going to be appropriate going forward.
Katie, I wondered if you have any reflections on the companies that you're working with when they have global reach, whether you see practice emerging very differently.
I think not so far on this. I think the major differences have been appetites for things like whether to wear masks or not and whether to get people back or not. But I wouldn't say that there's a kind of, I haven't seen a best practice example. I think with the multinationals, it's more just a feeling of, oh, God, this is just so complex and it's basically impossible to get it right across every jurisdiction. And if you do one organisation that I work with is headquartered in France, but has a huge population over here, and their HR director in France, they'd agreed that everybody would be given masks, but they weren't doing that in the UK, and then that was just creating a bit of tension between the employee groups that were saying, well, you've got it in this country, so why they've got it, why don't we have it? So it's more just the complexity, and because, as Dee said, because this is also new, it's kind of hard to know what the right thing to do is.
And Sid, you mentioned back to work. I think we both mentioned in the intro, and I think that's one of the pilots where there's actually been a lot more information in the public domain about what they're focusing on and who they're testing these with. But I think what's interesting about that is that the pilot, while it has some very clear questions, doesn't appear to explore or address any potential social consequences of such a tool. And I think there's a kind of, some of the founders involved in this are very kind of positive about the fact that immunity passports are just a blanket view that they will be beneficial because they will be more reassuring. And actually it's uncertainty that creates unnecessary fear and possible discrimination. And that's, I just wondered whether there's a challenge here about who owns those social questions if we're talking about the private uses.
Certainly, I think it is interesting. That mic on. Yeah, no, it's definitely curious at how much variety there is around the ethical discussions within companies. And there are certainly some who have, certainly around the issues of incentivizing discrimination. I know at least a few who will actually acknowledge this as a problem, and others who say, actually, I think my favorite idea was that you would essentially have, for example, I think it was a supermarket, you have one supermarket of people who had immunity and one supermarket of people who didn't. And it was just sort of this very blank idea that you could just easily separate people and it would be kind of however long you would need to do this, this would happen. So I think that it is concerning that there is a complete disconnect amongst at least parts of the digital identity community from the actual social, ethical problems on the ground. I think, to be fair, that there is more discussion from the ones I've spoken to in the UK around this. I think, I don't know if that's partially because we have quite a lot of, we have the CDI and other organisations in the UK who are sort of discussing these topics. But I think generally there is a failure to necessarily engage with the social aspects because it's seen as still being sort of a government or a business decision at the end of the day. Or individual companies will make this decision. This still seem to be the thinking from the digital identity companies I'd spoken to.
That's great, thank you. And I wondered whether, I've just seen a message pop up. We've got a question from one of the audience asking about medical devices that collect similar data and how that's regulated and how that compares to private devices. Dee, perhaps come to you.
Yeah, no, it's a really good question. So what you've again seen from the European Commission, for example, is this argument that actually you should see AI systems as being analogous to medical devices. So that in the same way that they are regulated, in the same way that you would have very specific rules around liability, in the way in which you would have to have compulsory insurance if you operated certain types of system, that we should borrow those ideas and we should translate them not to all uses of AI, but to AI uses that are considered to be high risk. And I think that I can see that as being a very powerful analogy. I think that's the big challenge here when it comes to thinking about ethical standards and regulation. You've got such a range of uses of tech. You know, your out of office is a type of algorithm and a type of AI. No one thinks that needs to be regulated and licensed and having an auditing system. But at the other end of the spectrum, you will have this very, very invasive technology that uses personal and sensitive medical data like a medical device. And the ideas that we have for regulating that field absolutely can and should translate to the workplace and to private employers in very different types of scenarios.
And I think as a follow-up to that, I don't know if you've seen recent, obviously the evidence base is emerging daily, but in a recent study they found that antibodies look like they start fading within about 3 months. Again, early days on the evidence. But I wondered whether it'd be interesting in all three of your opinions on how that changes the kind of both the opportunities but the complexity about this. The fact it might be short term, I suppose, in some ways might make it seem less risky in that what you are asking people to reveal is something that is very time contained, but also perhaps loses some of the benefits. And I think a kind of an additional complexity to this is what we understand from the clinical side and the research side is that we don't quite know what it means either for antibodies to mean immunity, but also what it might mean that the individual has produced those antibodies. Might they be revealing something about their health status that is not related to COVID or is much more, I suppose, long term? I wondered if you had any reflections on that.
I can have some thoughts on that. I think if there's no evidence or limited evidence that this actually works or works for a long period of time, then I think you probably risk losing more than you gain. I think if you think about the kind of stuff you're putting at risk, like you said, in terms of potentially revealing really private and health data about people that might feel really uncomfortable with their employer knowing, and the kind of impact that that's going to have on trust, I feel would potentially be a bigger risk than what you would gain by having data that potentially within 3 months is useless to you. And then the other thing I just wanted to raise was, something around the kind of the power imbalance. And obviously there is always a power balance between the kind of employer and employee relationship. But I think as we move into a period of deep recession, when people are going to be really concerned about their roles, I think that's another spectrum through which we need to view this, because ultimately you could be asking people to do something that normally they wouldn't consent to, but they feel that they have to, because what's the alternative? They might lose their job and their income. So I think that's another way we need to be thinking about this in terms of the ethics.
And Imogen, I think what's really important about your question is that I hope it doesn't stop being asked, because at some point we're going to come out of this pandemic, hopefully. But in truth, these types of very invasive technology and using data to infer other things about people has been going on for years. What COVID-19 has done is actually just put a spotlight on what has been a transformation in the employer-employee relationship. And again, a lot of this has come from the States. So we know in America there are apps which look at your social media history in order to infer what type of views you are, what kind of views you hold, whether you're the type of employee that an organisation might want to recruit. We know that chatbots are being used to make predictions about whether you're likely to stay with this particular employer or move in a short period of time, or whether that you need to be nudged with a pay rise, and if so, what's the minimum pay rise you can be given in order to remain an employee. Now, all of this is coming, and COVID-19 actually just brings to people's attention, because of the public health implications, something that is a real and important debate. What data are employers entitled to have? How can they use it? How long should they use it? Is there going to be mission creep? What else can they infer about you from this data? Are all really important questions that we need to be asking now and for years to come.
And just to follow up on that, one of the attendees put in a question around, do we perhaps need a specific mandatory DPIA, data protection impact assessment, to provide consistency and risk assessment of these sorts of approaches and devices? Dee, I think a question for you.
Yeah, and I think one of the big criticisms of data protection impact assessments is they're not public. They can be pretty limited, and they often don't look at the equality implications and the sorts of arguments that we were looking at earlier. I would be in favour of a much more meaningful auditing and assessment process, but crucially one that is transparent, so people can know how their data is being used. Sometimes people don't even know their data is being used. So there's a huge problem in terms of people's perception and understanding of what is going on. And I think something like a data protection impact assessment, but better, would be one step and one tool in terms of trying to fix that.
Brilliant, thank you. Well, we are almost out of time. I just want to return to each of the speakers, perhaps starting with Sid, on, given the conversation we've had today, given some of these emerging risks and what we know about the science, whether you think there are, what action you think needs to be taken, if any, by governments in terms of managing, advising, regulating, guiding, or I suppose testing the private use of these. So perhaps in answer to that, or any other closing comments, if we go in reverse, if we start with Sid and then move to Katie and Dee.
Yeah, that's an excellent question. I think governments are probably going to be slammed, honestly, trying to work out what to do. I think with regards to immunity passports or public health identity systems in particular, I think as Dee mentioned, I think there are certain cases where it does make sense, or at least is not as purely sort of evil as sort of being cast in some ways. And I know if you look on Twitter now, most of the tweets currently are about sort of people who say that Bill Gates is trying to inject us all with microchips related to specifically to COVID pass, I think, because they had a quite a big press release, and that sort of keeps doing the rounds. I don't think it is quite as bad as that. I do think there are cases such as in sports or sort of very specific areas where we do need analysis. But at the same time, the points about employer power balance are really important to consider. And I think that fundamentally the sort of idea of opt-in versus, actually sort of having exploitation, not exploitation is the wrong word, sort of being forced to act in a certain way really needs to be discussed. And I think whether or not that takes form of regulation or some other form of sort of inquiry by government, I think there needs to be an understanding fundamentally of what rights are being potentially infringed and what the trade-offs are.
And I think that any kind of more guidance is always helpful, especially because this is such a new and fast moving area, and also an incredibly emotive area where nobody is sure that they're doing the right thing. And I think most people want to be doing the right thing, but are just not sure what the right thing is or looks like. And then I guess my kind of closing thought to employers would be kind of what Dee said earlier, that you need to critically assess what the impact of any kind of technology that you're implementing is going to be. So what is the impact on people? And ultimately, you know, we're all using technology so much more in our jobs every single day, and, you know, we're all connecting like this because we can't be in a room together, and that's, you know, I guess it's great. Be nicer to be in a room together, but there's a kind of whole spectrum of tech and a whole spectrum of uses. So I think it's kind of incumbent on, obviously it's incumbent on government and regulators to perhaps provide some more guidance, but ultimately it is also incumbent upon employers, and obviously I would say HR leaders, because those are the people I work with, but the people who are responsible for the people agenda, to think about what the impact on employees is actually going to be, and then critically assess whether it's worth it or not, how to do it in the right way. Because, you know, there's a right way and a wrong way to do things. So if you do it by having really, really clear communication, by having a very clear story about why you're doing stuff, and you get buy-in, then using tools for monitoring, surveillance in some ways can be successful, but there's lots of ways where you can get it really horribly wrong as well.
I think for me, Imogen, one of the frustrations I have with this debate is that we seem to fall into this very sort of black and white kind of left versus right discussion. And you on the one hand, you'll have commentators say we can't regulate because we will stifle innovation. And then you have a kind of caricaturing of the regulation debate saying, you know, that actually what you need to have is freeing up business, and they're sensible and they can make their own decisions. And I think that polarization is wrong. I think actually companies are crying out to be told what is right and what is wrong here. I hate the word ethical because I don't know what it means, and I think businesses don't know what it means, and everyone has a million different ideas of what ethical means. And at some point we need to move beyond this kind of right and left debate and just have a really clear steer from the government saying, can do this and you can't do that, and actually be brave enough to provide clarity without fearing them being criticised for stifling innovation, because actually I think clarity will encourage it.
Brilliant. Thank you so much. I want to thank our three speakers for joining us, and everyone else for dialing in. It's been a really, I think, important and timely conversation about this. It's definitely, you know, this remains on our agenda. This is the point where I'm supposed to plug. We have an international public health identities monitor, which is being regularly updated, where we're keeping track of different countries' approaches, different companies' approaches, and that's available on our website. And as I said at the beginning, a recording of this webinar and a summary of the points will be available on our website in the next, well, either today or tomorrow as well. In terms of the series, we won't be holding any events across August. I think in light of COVID and all the remote working, everyone needs a bit of downtime and a bit of distance from their screens, but we will be back in September, and over August we'll be publishing further details on our website and on Twitter about events and further work in this field. So thank you so much for joining us. Thank you to our speakers, and take care.